Good people. Today we would like to focus on basic first aid. Um, this is basically a way to support anybody who might be found in a situation of emergency. We do have several levels of first aid, which is life support. Some would refer that as first aid 1, first aid 2, first aid 3. However, in our terminology, in terms of QCTO, we look at it as basic, intermediate, and then advanced. We would say that actually everybody needs an opportunity to learn about first aid. Reason being that whether you are at work or you are at home, emergencies are always there because we live with a lot of hazards. We live with a lot of incidents that can happen, and an incident cannot knock and let you know that I'm about to come. It just happens at any given point in life. Let's look at what exactly do we cover when we are teaching basic first aid. We first and foremost look at the legal aspects and ethics that we are bound as people who respond to emergencies, especially at workplaces, because this is an occupational health and safety type of training. So if you are at work, you are bound to meet a lot of emergencies and you need to attend to them. And these emergencies then can cause some of your workmates to end up being patients to you. Therefore, ethics are very important, of course, and the legal requirements of one to be a first aid is important. The next thing that we also look into is how do you assess what we call a primary survey. How do you assess a patient, somebody who has been involved in an accident, somebody who has been involved in any emergency. In that regard, we follow simple acronyms that we use to make life easier. We follow triple HABCs, where your triple H, they focus on what to do when you arrive at the emergency scene. That is, the first thing that you need to do is to look at the H. The first H is your hazards, right? And then the second H is your help. The other H is your hello, where you are actually trying to ascertain a communication with the patient. At the same time, the other H is defining your you calling for help, which is your emergency services or other people whom you are working with, depending on how broad is the emergency that you are attending. These first three H's are actually important because as a first aider, you need to understand the first H, which is hazard. Don't put your life, the life of bystanders, the scene where the incidents happen, as well as the life of the patient into more hazards because of you not taking care of the safety of the whole thing. At the same time, you cannot let a person be on emergency for too long without you having called for help, because if you are at workplace, no matter how small is the incident, it's very important to call for help for two reasons here. One of the reasons is that you need the incident to be documented with witnesses as well. And of course, a paramount reason of calling for help is you would want specialized treatment to be offered to the person who has just been injured at work or who has just been involved in an emergency. So those are two important things, because without documentation, without witnesses, you might find that more harm can be caused at workplace. That I will talk about in a different day on a different slide. Let's move on to our ABCs. ABCs are quite important because here we are now looking at, first, your A is the airway. We are talking about how do you clear the airway of a human being, where we know very well that the airway of a human being starts with the nose and the mouth, going down to the trachea up to the lungs here. Now, in that situation, people, when they are involved in an emergency, there's a high chance that either there is an object that is obstructing the airway, or even our own tongues. Our tongue does block the airway. Therefore, the first thing you need to do here is to clear the airway. Then the next step is to actually ascertain if breathing is there. You want to ascertain if breathing is there. That means you need to approach your patient, lay one of your hands or one of your palm on his or her chest, while you are also drawing your head closer to the nose and the mouth, where your ear will be able to pick if breathing is happening. At the same time, your other palm is actually also using sense of feeling on the chest of the patient for you to know if breathing is there, which is very important, because if breathing is not there, that takes us to the next step, where you will need probably to do CPR or to perform CPR for you to restore breathing unto the patient. Now, the last part is C, where we talk about the circulation. Basically, the circulation we are referring to the movement of blood right around your body, through your arteries, through your veins. Now, this can only be ascertained or be made sure if our heart is pumping. And how do we know if the heart is pumping? The correct way is to check the pulse. Now, a human body, ladies and gentlemen, has got several number of pulses, right? But the pulse that we are so worried about is the one that is here by your neck, or by the neck of your patient. And remember, you can't use your thumb to test or to feel for pulse, because your thumb already has a pulse on its own. You might be feeling your own pulse. However, you would want to use these two fingers, your middle finger and your index finger, and then you draw them closer to the neck of the patient, and you are able to pick if there is a heartbeat or not, right? So these becomes your ABCs. If you are involved in a training for first aid, you will find that from time to time we will refer to say check your ABCs or perform your ABC check. When we are saying perform your ABC check, we are referring to that moment where you have to go back, check the airway, check the breathing, check the circulation of your patient. That way, for instance, if somebody is wounded or has got a fracture, right, that person might still be breathing, might still be performing other things. But when we talk about first aid, we then say a practitioner needs to do ABCs from time to time. Having done your primary survey, which is your ABCs, then you move on to the secondary survey. All right, when we talk about the secondary survey now, we are referring to somebody who has come to, somebody who has proven that he is conscious or she is conscious. And you would want now to find out to what extent is this person conscious, or to what extent is this person wounded, or to what extent is this person affected by the situation that he or she is. They would need to find out by making or creating a conversation with the patient, such as asking the name. Hi, how are you? What's your name? What have you been doing? Where are you? What caused this accident? If the person is able to converse with you or to answer you correctly, you are able to know that there is some level of consciousness. The next thing you check is the dilution of the eye pupil, right? Our eyes are very good in determining to what level of conscious are we. Anyway, in our next slide, we will be talking about more on the issue of secondary survey. We'll be talking more about other parts of first aid. Here we have just been giving you introduction. If you want more, follow us in all our social media or visit us at Lusatech Training Academy. You would get more, you would get experienced facilitators who will give you the best of training in terms of first aid. We are out.